Developmental disturbances in shape of the teeth. So developmental disturbances in shape of the teeth include gemination, fusion, concrescence, dilaceration, talus cusp, dens in denti, dens evaginatus, taurodontism, supernumerary roots. These are the developmental disturbances in shape of the teeth. So the first one is gemination. So the geminated teeth are anomalies. It arises from an attempt at division of a single tooth gem by an invagination. So it is a single tooth gem. It gets divided. So with the result an incomplete formation of the two root. So the structure is usually one with two completely or incompletely separated crowns that have a single root and root canal. So it is very important. The crown is completely or incompletely separated, but the root and the root canal is single. So it is seen in deciduous as well as the permanent dentition, and in some cases appears to exhibit a hereditary tendency. It is due to the hereditary tendency, and it is not always possible to differentiate between gemination and in case which there has been fusion between a normal tooth and supernumerary tooth. So the differentiation is difficult. So this picture showing the gemination tooth that involve the lower lateral incisor and the canine. There is a crown completely joined, but the root is single. Twinning. What is twinning? Twinning, it is the production of equivalent structures by division resulting one normal tooth and one supernumerary tooth. In gemination there is two normal tooth gem or a single tooth gem. It produces two crowns, but in twinning here one normal tooth and one supernumerary tooth. Next, moving on to the fusion. Fusion of the teeth. It arises from the two normally separated tooth gem. In gemination there is single tooth gem. By invagination it gets divided, but in fusion it has union of the two normally separated tooth gem. So the stage of the development of the teeth at the time of union, fusion may be either complete or incomplete. So it has been thought that some physical force or pressure produces contact of the developing teeth and their subsequent fusion. So some physical force or pressure, it produces the contact of the developing teeth and their fusion. So this picture showing the fusion, it is a two normally separated tooth gem. So the fusion occur at any stage of here the single root but crown is two. So this picture, first one is gemination and second one is fusion. In gemination there is single root, in fusion there is single or double the root. So if this contact occurs yearly, that is before calcification begins, it produces two teeth completely united. If the contact of the teeth occurs later, it may be the union of the roots only. So yearly, before calcification, it produces two teeth completely united. After contact, may be union of the root only. So the fusion affects two normal teeth or occur between normal tooth and supernumerary tooth, such as mesiodens or distomolar. So it has also hereditary tendency. The possible clinical problems related to appearance, spacing and periodontal conditions are also present in these patients present in the conditions. Next, moving on to concrescence. Concrescence of the teeth is actually a form of fusion which occurs after root formation has been completed. So fusion, it occurs any developmental stages it occur, but in concrescence it occurs only after root completion. So if this condition, teeth are united by cementum only. So complete teeth are formed, so it united by the cementum only. It is this thought to arise as a result of traumatic injury or crowding of the teeth with resorption of the interdental bone. So cause for this condition is traumatic injury or crowding of the teeth with resorption of the interdental bone. So two roots fused by deposition of the cementum between them. So concretions occur before or after teeth erupted. So it occurs before or after tooth erupted. So the diagnosis is radiographic examination. With fused teeth, the extraction of the bone may result in the extraction of the other. So this picture showing the concretions, the molars are united by the cementum only. So this is an example of concretions. Next, moving on to dilaceration. Dilaceration refers to an angulation or a sharp bend or curve in the root or crown of the formed tooth. So dilaceration is an angulation or sharp bend or curve in the root or crown of the formed tooth. So the condition is thought to be it is due to the trauma during the period in which the tooth is forming. So trauma during the period in which the tooth is forming. So position of the calcified portion of the tooth is changed and remainder of the tooth is formed at an angle. So the curve occur anywhere along the length of the tooth. It occur at cervical portion or middle third of the root or apical third of the root. So dilacerated teeth, it produces during the difficult problems at the time of extraction. Before we don't know the dilaceration tooth. If it angulated, mostly it produces difficult problems during the time of extraction. So we have to preoperative radiograph is taken. And this picture showing the dilacerated tooth. There is a root curved at the apical end. So this is the X-ray picture showing the molar having dilacerated root. Next, moving on to the talon's cusp. Talon's cusp, it is an anomalous structure resembling eagle's talon. So talon's cusp is resembling the eagle's talon. It projecting lingually from the cingulum areas of the maxillary or mandibular permanent incisor. So mostly it occur or definitely it present on the cingulum areas of maxillary or mandibular permanent incisor. So this cusp blend smoothly with the tooth, except that there is a deep developmental groove where the cusp blend with the sloping lingual tooth surface. So it is composed of the talon's cusp. It is very important. Talon's cusp is made up of normal enamel, dentin, and contains horn of pulp tissue. So horn of pulp tissue it contains. So this picture showing the central incisor having talon's cusp in the lingual side of the lingual aspect. So this is the talon's cusp. So this anomaly has been discussed by Meller and Ripa, who have emphasized the problems it poses for the patient in terms of it produces some problems that are aesthetics, caries control, and occlusal accommodation. So we have to prophylactically restoring the groove to preventing the caries, and if there is occlusal interference we have to remove that cusp, but exposure of the pulp are necessitating endodontic therapy. This condition is quite uncommon among the general population. So mostly this condition is present in the Rubinstein-Tabby syndrome. It is very important, Rubinstein-Tabby syndrome. Next, moving on to dens in denti. Dens in denti, also known as dens invaginatus, dilated composite odontome. So dens invaginatus and dilated composite odontome are the other names for dens in denti. It is a developmental variation, and the invagination in the surface of the tooth crown before calcification has occurred. So the invagination is in the surface. It occurs before the calcification occurs, and it causes for this condition is increased localized external pressure, focal growth retardation, focal growth stimulation in certain areas, that is tooth bud. These are the causes for this condition, and permanent maxillary lateral incisors are frequently affected. This condition is mostly bilateral, but and dolochia says radicular invagination is due to the infolding of the Herdwick's sheath. So this condition is bilateral, and but and the lochia radicular invagination infolding of the Herdwick's sheath causing this condition, and dense and denty is the synonym for tooth within the tooth. So in the mild form it is not clinically seen, but in radiographically pear-shaped invagination of the enamel and dentin with a narrow constriction at the opening on the surface of the tooth and closely approximating the pulp in its depth. So in mild form it is not seen clinically, but radiographically it is seen. There is a pear-shaped invagination on the tooth surface. So it is this is the dense and denty. The infolding of Herdwick sheath and takes its origin within the root after development is complete. So this picture showing a slight invagination may be seen in the lingual pit area of the maxillary lateral incisor on the radiograph. This is the example of dens invaginatus. Next, moving on to dens evaginatus. The other names for dens evaginatus are occlusal tuberculated premolar, Leong's premolar, evaginated odontome, occlusal enamel pule. So what is dens evaginatus? So it is a developmental condition and it appears clinically as an accessory cusp or globule of enamel on the occlusal surface between the buccal and lingual cusp of the premolar. So there is a accessory cusp or globule of the enamel on the occlusal surface between the buccal and lingual cusp of the premolar, and it is unilaterally or bilaterally seen. So here the pathogenesis are proliferation and evagination of an area of the inner enamel epithelium and subsequent odontogenic mesenchyme into the dental organ during early tooth development. So it has been considered to be the antithesis of the mechanism of development of the dens dentii or dens evaginatus. So this picture showing that second premolar having the globule between the buccal and lingual cusp. It is the dens evaginatus. Next, moving on to taurodontism. So taurodontism, body of the tooth is enlarged at the expense of the root. So it is called bull-like teeth. So taurodontism called bull-like teeth. Classifications are hypotaurodont, mesotaurodont and hypertaurodont. These are the classification of taurodontism. And what are the causes for this condition is, first one is specialized or retrograde character, and second one is primitive pattern, third one is Mendelian recessive trait, and fourth one is atavistic feature, and fifth one is mutation resulting from odontoblastic deficiency during dentinogenesis of the root. These are the causes for this taurodontism condition. So Hammer and his associate believe that the taurodont is caused by failure of Herdwick's epithelial sheath to invaginate at the proper horizontal level. So failure of Herdwick's epithelial sheath to invaginate at the proper horizontal level produces taurodontism. The next is Klinefelter syndrome. Most commonly these patients having this taurodontism teeth, but it is not a constant feature of this syndrome. So Klinefelter syndrome, males whose sex chromosome constitution includes one or more extra X chromosome. So it and Gardner and Girgis have recommended that male patients having taurodontism should have chromosomal studies performed. So next, moving on to clinical features. In clinical features, it may affect either the deciduous or permanent dentition, although permanent tooth involvement is more common. So the teeth involved are mostly invariably molars. Sometimes only a single tooth, at other times several molars in the same quadrant are affected. And radiographic features, the unusual mature of this condition is best visualized on the radiograph. The involved tooth frequently tend to be rectangular in shape, and pulp chamber is extremely large with greater epico-occlusal height than normal. So it is a bifurcation or trifurcation and few millimeters above the apeces of the roots. And treatment, no special treatment is necessary for this anomaly. So in radiograph, it is a rectangular shape. So this picture showing the mandibular second molar having the taurodontism. Seeing the shows the rectangular shaped tooth. Next, moving on to supernumerary roots. Supernumerary roots are not uncommon and may involve any tooth. So teeth that are normally single rooted, particularly the mandibular bicuspid and cuspid, often have two roots. So if unrecognized and allowed to remain in the alveolus, if this phenomenon is of considerable significance in exodontia, that is extraction, for one of these roots may be broken off during extraction, and if unrecognized and allowed to remain in the alveolus, it may the source of infection. So we have to take X-ray before extracting the tooth. If the extra tooth allowed to remain in the alveolus, it may be the source of future infection.